this will be just really good to kind of more deep dive into the work that you do at ReDiscover Psychological Services.
Big name.
Yes, there's no mystery about what you do, but you might wanna just give a little bit of information about ReDiscover and what your role is there before we start.
That sounds great. Yeah, my name is Wanda Chevrette. I am the CEO of ReDiscover Psychological Services, as the name suggests, psychological services. We do mostly therapy services. However, I do dabble in assessments as well, more for the courts and a different side. So we'll just stay focused on the therapy that we provide. We do a lot of workshops, as Karen just mentioned. So one of the big ones is healing trauma. So this is a 6-week workshop, and we will get into more information there. But I have a team of clinicians. I think we're 5 strong right now. We had 3 locations. We now just have 2, just for the sake of trying to put it all into the downtown location.
Okay, nice. Okay, so as you mentioned, you have workshops, and the one that is the one we're going to talk about is the healing from trauma, as you mentioned. And it's obviously an ongoing one. It's I think there's more than one part to it as well, right? So okay, so first of all, let's talk about the beginning of that. What kind of workshop is that? And then I'll ask you more specific questions as we go.
Yeah, so healing from trauma, as the name suggests, it's a trauma workshop. So we believe as therapists that trauma healing occurs in 3 phases. So the first one is stability. So in the current workshop that we are hosting, we are focusing on stability. And then the second phase is actually trauma processing. And then the third phase is reintegration with society, because what we know about trauma is when we have been traumatized, in a lot of cases we break off trust with other people and we close into ourselves. So the third step is more of a reintegration with society, loved ones, jobs, whatever that could look like for the individual.
Okay, yes, that's important. You can work on yourself, but how do you get back into life around you? Yeah, that's good. Okay, so what would be the format of this meeting? How long is it? What does it look like in the space that you're in?
So we actually use a space in Expand Your Roots. So that is on White Avenue, just off of it, on 105th there. And my friend Sarah, which is another registered psychologist, she has been so gracious to let us use her space, and she also co-facilitates this group. So it's a group therapy. It is 6 weeks long. We do it very casually. So we're very casual people, so we want to, make it welcoming and inviting for people. I think that's essential, especially for people that have survived trauma. We need to make sure that it's inviting. And so what we really do is we provide a lot of psychoeducation around trauma. What does trauma look like? What's the definition of it? What symptoms you could be experiencing. A lot of times people experience symptoms and they're not aware of them, so that can become really frightening. So we kind of normalize that. These are the symptoms that are often associated with trauma. And then we teach some coping strategies around trauma, when to identify, things like flashbacks, dissociation, and what you can do about it. And really what we're doing is we're offering a lot of stabilization tools. And what that means is when we're heightened with trauma, we get emotionally heightened. And what we want to do is we want to teach a person how to ground themselves so they're not so distressed all the time, especially being triggered. So we teach how to identify triggers for ourselves for a particular trauma, and then what we can do when we are triggered to help ground ourselves so we're not distressed in that situation. And so that's essentially what we're doing in the first phase of trauma treatment. Just really mindfulness, breath work, other tools and techniques to really help ground the individual.
Okay, wow, sounds amazing. So you said it's a triphasic approach to trauma treatment. You've kind of already explained that. When would you move into the next phase? Do you automatically qualify to go to the next stage?
Um, so yes and no. If you are feeling that you are, it's really guided by you. So the client. So if you're feeling that you're not able to ground and you're not ready for phase two, because that is trauma processing, and we want to make sure that you are well grounded, you know how to do that grounding work, because as soon as we start doing trauma work, we don't want you to be dysregulated trying to do trauma work, because that's really upsetting for your life, upsetting for work, upsetting for your friend group, upsetting for relationships. So we want to really make sure that you have the tools and that you're feeling comfortable to move into the next phase. So really it's a conversation that we have, and it's something that is open to you. And also important to mention is, even getting into the first phase, we will do an assessment and an intake to make sure that you are in fact a good match for the program. Because again, we want to make sure that you're remaining grounded, or you're able to learn the skills necessary for grounding. And if you're not ready, that's fine, because we do have individual therapists that can help ready you for the group as well. So it's not, we're not saying, no, you can't get healing, because obviously we want to provide healing, but it just might be more appropriate on an individual level. And then, of course, we're going to do the same for phase two and phase three to make sure that it is inappropriate. And phase one is mandatory for phase two, and then phase one and two for phase three. And that's simply because we want to make sure that you learn the skills and tools needed in order to enter into the next phase. It's really important.
Wow, sounds very thought out and unique to each person, depending where you're at. And I can see that, yeah, if you're not quite ready for that group sharing, then it would be very imperative to move into more a one-on-one setting. So that's great.
Yeah.
So that definitely sounds like a safe and stable environment. And that kind of is one of the things that you mentioned on the description of the group. The somatic resourcing techniques, can you describe that like in an easy way? That's one of the things that it said that you used during the workshop. So I'm just wondering about that.
Yeah, and actually that's Sarah's department, because she is a somatic therapist. But essentially we're using our body. So our body gives us cues. And it's very important that we learn how to listen to our cues of our body in the early stages, because your body will guide you. Your body will tell you when you're ready. Your body will be essentially the tool that you're going to move forward into trauma healing. And so what we want to do and what we want to teach is skills to become attuned with our body, to know what it's telling us, and to listen to our voice. Oftentimes in trauma, especially sexual trauma, our voice is taken away from us. And so essentially we're trying to build that voice and trust that voice kind of moving forward. And the first step to that is being able to listen to your body and what your body is providing and telling you.
Wow. Okay, that sounds really good, actually. So I have another question. What impacts from trauma are the most common for many people?
So anxiety is the number one, and what a lot of people associate with what anxiety, and in the body, it's the heart racing, the blood. You can feel your blood kind of pumping through your vein. You're attuned to your environment, hyper attuned to your environment, what we call hypervigilance. So more jumpy, agitated. Depression comes with that as well. Where there's up, there's a down. And so we're getting deep sadness, grief in a lot of cases. Startled response, fear, not being able to trust anybody. And that's a hard one, sometimes not even being able to trust self. So those are the most common symptoms that we see.
Okay. Okay, and one other question I had about this workshop was EMDR. What does that mean? And just a simple explanation. Big one, I'm sure.
Yeah, it's a lot. So EMDR is eye movement desensitization reprocessing therapy. So it is something that I offer both in individual and getting into group practice if it is appropriate for the subset. And so what we are doing is we're doing neural network processing. So that is a big thing. It deserves a whole kind of show on its own to describe that. But really, we're trying to find associated events within the neural network and healing that, and then using our adaptive processing in order to, I guess, re-script, for lack of a better word, and heal.
Okay. Yeah, sounds like it's a topic on its own.
Yeah, it really is.
Yeah. So you've already given obviously some examples of strategies and tools and techniques that are used in this workshop. But what about when you're at home? Like, is it easy to take those and just apply them at home? Were there any other ones you wanted to mention that are typical in the workshop?
Yeah, so the grounding techniques is definitely, we make it so it's appropriate to use at home. So not so much EMDR. We do recommend that you do that with a therapist at all times, and that's just because therapists are trained to know what they're looking for, and sometimes we can become dysregulated or dissociated, which means that we're losing touch with reality, and then it becomes an emotionally unsafe place. So for something like EMDR, we definitely recommend that you do that with a therapist. However, the skills that we do teach, especially in the first phase, so the first phase, we won't go into EMDR, we won't go into somatic processing or any of that. It's just really stabilization. But we do teach it so you can use it at home. So something like even tapping can be utilized. So it is a subset of EMDR. Not going to overwhelm you with details, but that is something that you can utilize at home. And same with the grounding technique. So using mindfulness, meditation, breathing, muscle relaxation, things like that you can utilize whenever whenever you're triggered, really.
Right, when you need it. Yeah. Okay, so that's kind of what you can expect or can do at home. But after you start these sessions, what can you expect at home, and just even as you're processing, just even in the first phase, like what should you be doing between group sessions, like week to week sessions?
Wow, you really brought out the hard questions, don't you?
Well, answer as much as you can at a basic level.
So really, anytime that we are working with trauma, we are becoming heightened. We're being reminded of traumatic events in our life. Most people want to avoid those, and we're asking you to bring them up and bring them up repeatedly. So even when we're offering stabilization, you are going to be remembering the events that happened, hence why you're coming to the workshop. And so what you can expect in between is you can expect heightened emotions. And again, we teach you skills really quickly so you're able to de-escalate, to notice and de-escalate yourself, and remain calm. But you are going to notice that you're going to see an increase in some of the symptomology that you've been experiencing, and that perhaps that you've been avoiding as well.
Okay. Yeah, I'm sure. How much is expected to be shared in the group sessions? Do you want the involvement, I guess, start with that. How much is expected to be shared in the group you as a participant share in the group session?
So none, actually. We encourage not to share. And this is simply because of vicarious trauma or secondary trauma. We don't want to bring that to a group setting. Everybody does have trauma, and there is an appropriate time to share it. And generally, maybe in the second phase of treatment, when everybody has that stabilization, and they become masters at stabilization, that might be an appropriate time to share. But for the first one especially, we encourage not sharing, because we don't have the skills and tools in order to manage that in a group setting at that point as the client. And so we just want to be careful that we're not also traumatizing another person with our stories. That's very important. Everybody deserves to feel emotionally safe in the environment for trauma processing.
Right. Actually, that's what popped into my mind when you were describing that, is just keeping it safe so that you can continue coming and eventually get the healing that you need and want.
Yeah.
So there was one question that stood out. This is my last question for you. And you can add more of anything else that you didn't get to say. But what does it mean to show up in your wholeness? And what does that look like?
So really what we ask the group to come as, so individuals to come as themselves, as their authentic beings, looking for healing, looking for tools, being willing to be part of the group. Not to share necessarily your story, but to be willing to sit in that the group dynamic, because it is a different dynamic. You're not just individual with your therapist, you're actually with other individuals that have also survived trauma. So just coming, being willing and open to learning, learning about self, learning about others, learning about the process, and just be willing. And that's kind of what we ask, is just be open to that process.
Nice. Okay. Sounds like a great workshop, and I can see how helpful it is for just obviously healing, but then moving on and, living your life to the fullest. So was there anything else you'd like to add that maybe I didn't ask, or do you feel like you covered the basics of, this trauma?
I would like to add that this particular group shop that we're running in October, that is open to anybody. In the past, we've only had open to non-insured health benefits, so Indigenous that have intergenerational trauma. This is open to anybody that's experienced historical trauma or intergenerational trauma. And we will be, however, providing smudge still, because that's part of my practice and part of my healing. And I know that's part of a lot of Indigenous individuals' healing as well. So we will be offering that. If somebody is not wanting that, we will ask them to come later so we can do that ceremony.
Okay. Wow. Okay. That's interesting. I love it. Well, thank you so much for sharing, and I look forward to hearing how successful, I guess not just the workshop, but how successfully you can help people heal from the trauma and facilitate that. So.
Yeah, we've had a lot of really positive feedback after our first workshop. So I'm really looking forward to it. And we provide manual, like a book as well. So that's been really helpful to kind of take home with clients, and they're able to utilize that and be reminded of their skills and tools and their strength going forward, not only in the healing process, but also afterwards.
Oh, that's great.
What a great feedback.
Yeah, that's great. Awesome. Okay, thank you so much, Wanda. And we will talk to you again soon and see how it's going.
Yeah.
All right.
Thank you very much.